Hello and welcome. This is Analysis and I am Oyi Adekunle. After years of painstaking efforts, Nigeria is finally in the last stage of being declared polio-free. Since August 2016, not a single case of wild polio virus has been recorded in the country. And just last week, Nigeria's complete documentation for wild polio virus free status was accepted by the Africa Regional Certification Commission for Polio Eradication, that's ARCC. And before now, Nigeria had been the only African country without required documentation to justify a polio virus-free status, and thereby preventing the continent from being certified polio-free. But this is a significant game changer for the country, considering the fact that, according to the World Health Organization, Nigeria accounted for more than half of all polio cases worldwide in 2012. But now, in a matter of weeks from now, Nigeria will be officially acknowledged as a polio-free country. Now, joining me to shed more light on this is Dr. Tunji Funsho'S, who is the chairman of Nigeria National Polio Plus Committee of Rotary International. Many thanks for joining us on the program, sir.
I'm delighted to be here.
Yeah, it's been a long time coming, no doubt. Could you please just briefly take us through this process? How much of a milestone is it for Nigeria?
As far as polio eradication is concerned, it is the greatest milestone we have achieved. As a matter of fact, officially, WHO, has pronounced us a polio-free country 4 days ago. As a result of our being declared a polio-free country in August, WHO will now certify Africa a polio-free region, which will only leave, the East Mediterranean region as the only region that is yet to eradicate polio because of the persistence of the virus in Afghanistan and Pakistan. It has been a very long, arduous, sometimes frustrating journey, but we thank God and we thank all our global polio eradication partners and the government of Nigeria at the federal, state, and local government level for seeing us to this day where we can jubilate that we have literally removed the wild polio virus, and as a consequence, the disease that has been paralyzing and killing our children, literally for centuries.
And so with this certification, does it mean that Nigeria is no longer at risk? I mean, can we now go to rest knowing that polio is gone for good?
Oh, no. I mean, we should celebrate that there is no more wild polio virus in any nook and cranny of this country. But as long as there's polio in any part of the world, we must continue to keep polio at zero in Nigeria, not just by word of mouth, but by deeds. We need to ensure that children still receive regularly their routine immunization for polio and also other childhood diseases. And of course, from time to time, we'll still be carrying out door-to-door campaigns once the COVID-19 pandemic, allows for that, so that there's no risk, to both volunteers and also to families. So we need to ensure that children continue to be immunized against polio. It is very important, to let people know that the vaccine is quite safe. And currently, our level of coverage is quite low. We need to get the coverage across the country of routine immunization to about 90%. If we get it to 90%, even if the virus comes in from anywhere, there should be no fear that our children will contract the disease. Currently, some parts of the country are still as low as 10%. We need to ramp up those figures. So it's very important now for us to apply our resources, both human and material, to ensure that children get their routine immunization regularly. And when we come around in future to continue, because we'll still continue our house to house until we are sure that majority of our children are covered, to make their children available. So it is not done yet. We can sleep better now, but with one eye open to make sure that we keep polio at zero.
And with, from your own experience, why would you think that people would reject routine immunization?
It's not a rejection. We don't have much of rejections anymore. It's a question of accessibility and a question of educating parents and caregivers. As you know, in some parts of this country, it's a long road, it's a long way to get to a primary health care center for children to immunize. So we need to create access both in form of distance and access also in form of availability of the antigens so that children can be immunized. Some states are doing quite well. They are providing transportation for families to be able to access, distant healthcare centers. But we need to do more. We need to do more by increasing the number of active, functional primary healthcare centers across the country, and also educating parents and caregivers as about the need to ensure that their children get the relevant immunization when due.
Of course, I'll agree with you that there are still places in this country where we have issues of accessing kids. And for instance, northern Nigeria, due to insecurity and maybe other issues. So is there a kind of surveillance system going on in that place? Because we also have a peculiar situation now with the coronavirus pandemic. So what exactly is on ground in places like that?
Well, one of the cardinal structures of polio eradication is to have a robust surveillance system. In other words, let's take polio for instance. Anywhere a child is seen with difficulty in moving any limb, whether it's the upper limb or the lower limb, there are people who are trained to get into those areas, get information from parents, collect stool samples, and send these stool samples through a process that is well documented, that they are trained for, to our regional labs in Ibadan or in Maiduguri, where they will determine whether the paralysis is due to polio or not. This is called, the surveillance system. And every local government has got what we call a disease surveillance and notification officer. And he or she has contacts, with the other smaller units at the local government level, which are the wards. And there are also informants at those ward levels who will inform him or her when they recognize, such cases. And of course, all centers where any form of healthcare takes place, be they pharmacies, patent medicine stores, motor parks, and such areas where children can be picked up, there are informants, as we call them, who will take the message up until the DSNO is notified. That is, the disease surveillance and notification officer is notified, and he or she will take the necessary steps to make sure that the proper diagnosis is made. So that is what has informed us. Part of our documentation that the ARCC had found quite good and in order is actually looking at this surveillance structure, without which you cannot look at anybody in the eye with any honesty and say there's no more polio in any environment.
And again, I'll ask you, what measures are in place now? Because we need to guard this our gains, protect it at all costs. So what exactly are we doing now to see that we protect this?
Well, currently the most important thing to do is to advocate for children to have routine immunization. Like I said earlier, we're still going to, as soon as the COVID-19 pandemic allows, we're still going to resume our house-to-house immunization activities, just to make sure that we cover the gap of the immune coverage of our children from the low level that we have now to the kind of level of 85–90% that we expect, after which it will be almost impossible, even if the virus comes back to Nigeria, to infect a child. So our main focus now should be to advocate and to make easy access of mothers and caregivers to have their children immunized in a routine way, and then we'll augment that from time to time by house-to-house immunization activities.
All right, Dr. Funsho,
it's very important to continue educating our parents and caregivers.
All right, so you tell us more, Dr. Funsho. We still have you here, but we'll go on a short break now and return to talk about COVID-19 and polio eradication in Nigeria.
In the last 3 years, we have built a multi-purpose center, which is the envy of all in our constituency. And I can tell you that the people who are living there are already enjoying it.
Guy, do you think what this man just said is true? See, I seriously doubt. I'm sure it's one of those their silly lies.
Wait, do you know there's a way to find out if these things he's saying is true or not? This is the Construct app. It gives people like us a sure way to track implementation of constituency projects. It gives valid and verified information on location of projects, amounts allocated, amount funded, the level of job done, and even the profiles of concerned legislators. You and I can post directly on this app.
Are you serious?
This is the Go-To app if you want to know how our Commonwealth is being expanded by the government.
Wow. Let's even see if what this man said is true. Show me.
The Construct app is developed by Other People Nigeria with support from USAID and is available on both Google Play Store and Apple Store.
And it's true.
Of course, I told you.
Now believe this Koroti. You know if you touch black man. If you like, gather the whole Niger, come together, make the cough. Nothing.
Which one you want?
Give me V&D.
I beg, get small pieces.
How much you want to give her?
Give me 200. Take your change now, Ruby.
You don't want your change. My people, this coronavirus, na serious matter. May una wash una hands regularly. Come use alcohol-based hand sanitizer. If you no see water, wash your hand. Make una sit down for house. You see this virus, so e no get leg. Now we dey waka kurukere. No waka around make the virus for die. No forget say the betterment of our people now for your handy day.
This message is from the Akinfade Foundation in partnership with the National Orientation Agency with support from MacArthur Foundation.
Welcome back to the program. I still have Dr. Tunji Funsho, the chairman of Nigeria National Polio Plus Committee of Rotary International, and we've been talking about Nigeria on its way to being declared polio-free. Yes, Dr. Funsho, thank you very much for staying with us. Now I'm going to ask you, how has it been so far with COVID-19 now in Nigeria and fighting the polio and working hard to see that Nigeria is really polio-free? How has it been so far for you?
Well, it has been very challenging times, for the polio program. But the good part of it is that, the polio infrastructure is now being deployed to assist us in ensuring that, we get rid of the pandemic. I mentioned earlier about surveillance. Surveillance also involves contact tracing. And a lot of the staff and a lot of the man hours, we're talking between 60 and 75% of the man hours that we're using for the polio program is now being transferred to assist in seeing that we see the end of the pandemic of COVID-19. So the surveillance officers I mentioned earlier are working to also identify, cases of COVID-19, also help in doing contact tracing apart from the enormous numbers of people who have been recruited and deployed to do this. We're also, using, our staff and volunteers. Personnel also who will be carrying out these responsibilities we spoke about. As you know, contact tracing is very, very important in trying to curb the COVID-19 pandemic. Because if you cannot trace contacts and test them and see whether they are positive or not and isolate them, then the spread, will be much more, and many more people may succumb to COVID-19. So we are deploying the structures that we created for polio eradication. We are deploying it to assist. At the same time, we are using our existing structures to encourage mothers and caregivers to continue routine immunization. As you know, many people are afraid to go to health facilities now because of the COVID-19 pandemic. And I think this is a good opportunity for me to remind parents and caregivers that primary healthcare centers still continue to give routine immunization despite the pandemic, and they are taking very stringent measures to make sure that there are no risks to parents, and children when they come to such health centers.
All right, and so what lessons can Nigeria learn from its fight against polio, and now that can now be channeled into tackling other diseases, including the COVID-19?
I think the first, and foremost, is that there's no health intervention that is impossible once we decide we want to do it. The second thing is when you form a coalition of people with the same vision to do something in the health sector in particular, success is ensured at the end of the day. In the case of polio, it has been a great collaboration between the government at every level, our DPI partners, WHO, UNICEF, the CDC, which is the American Center for Disease Control, also the Bill and Melinda Gates Foundation, the Aliko Dangote Foundation have been very helpful in most of the northern states, and also in recent times the Gavi Foundation, for vaccines, who have joined the GPEI. I think it is a good template for us also to see to the end of a lot of other health issues, particularly health issues that concern third world or developing countries, as we would like to name them. So basically, it is to have a public-private partnership for doing good in the world. I think polio eradication in Nigeria has proven to be the case. Polio eradication around the world also has been very, very successful. We have been 99.9% of the way. Starting from 125 countries, we have just 2 countries, Afghanistan and Pakistan, left. We also have come down from seeing 350,000 cases every year to seeing barely less than 100 cases in a year. But we always want to stress, 1 case of a child paralyzed by polio is a case too much, and we need to see the end of it in the world.
All right, so with this now, you think that we're in a better position to handle any situation in terms of tackling diseases now?
It's almost certain, because already we are transferring some of the assets, for polio eradication to look at other areas of intervention. Like I said earlier, we have now used the polio infrastructure to assist us with the pandemic of COVID-19. We have a huge number of human resources who are highly trained in public health now, who can now be deployed at a moment's notice to tackle on any other areas of health intervention that the partnership may decide upon. I think it's a good structure that we have developed, and it's a good legacy we have left as a result of the polio eradication efforts, for other health interventions to become successful.
Dr. Tunji Funsho, we appreciate you for your time, and we also say thank you for your efforts, as well as other stakeholders, to ensuring that Nigeria attains this polio-free status. Thank you so much for your time, sir.
Thank you very much for giving me the opportunity.
All right, sir. And this is the much we can take on this episode of Analysis. Many thanks for watching. I'll see you again next time. I am Onyi Adekunle. Bye-bye.